I think everyone has access to a lot of information about the spread in the U.S. and the various uh, cities that are struggling. We haven't seen a great flattening of the curve in many places. The state of Washington actually appears to be, entering that phase, at least from some early data, but New York clearly has not yet, and California, it's iffy as to whether or not that will happen. It's interesting because we have a lot of staff in China, and we have a lot of a lot of companies that do healthcare investing in China. And when you talk to them, what China did early on was by taking 60 million people and saying, you can't leave this particular area, no one can go into this particular area. They really reduced the overall exposure in the country to to the virus. Now, whether or not they have a second wave, that's all to be determined. But they were very effective early on by an extremely strict quarantine. At this point in China, if you fly to Beijing, you will not be able to do anything for 14 to 17 days from the time you get on the plane until you complete your quarantine in Beijing. Same thing for Shanghai. And so those are steps that the United States has not yet taken. So I think the U.S. has remained relatively open with people traveling between states, between cities. You see some of the examples where people have probably been overdoing that a little bit. But so I think it's too early to say that we're anywhere near flattening the curve in the U.S. For Montana, I was just on the phone with Senator Daines, and he mentioned we've had a couple deaths up in the Libby area, people with compromised lungs from the mining and things in that region. So he's doing some fantastic work in terms of actually heading up the Senate efforts on next generation diagnostics, next generation therapeutics, vaccines, and so on. So Montana doesn't appear, at least to me, to be anywhere near the forefront of discussions. Right now, it was China initially. You look at what's happened in Italy, you look at what's happened in the United States. We still don't know the exact vectors on how this has been transmitted. So there's still an awful lot of learning to be done. One thing I would just highlight for folks, if you look at the response, this has really been in the system for, let's say, 3 months, January, February, and March. If you look at what happened during the financial crisis or some other significant events, the 2000 .com crash, it literally took 8 to 12 months from the time that you knew there was a problem until the time that you actually saw solutions being propagated in the market. This is actually happening much quicker. No government wants to deliver bad news to its people. So China certainly could have done some things earlier. The US could have done some things earlier. But when you look at the collective responses now, they're actually coming awfully fast. And a great deal of work and energy is being put towards this. Unfortunately, this is not something where you have a quick solution, or you have a 6 month, in 6 months from now, we'll have a vaccine, and so there'll be a cure, if you will. Consider that. So the timeframes don't work in our favor, but the response has actually been quite rapid.